Okay, welcome back. Okay, so this is the verse of the day. Neither height nor depth nor anything else in all the creation will be able to separate us from the love of God that is in Christ Jesus our Lord. Romans 8:39. So we're going to start with opportunistic fungal infections. Alba means white, so Candida is always going to be white. It's a dimorphic fungus. Candida forms pseudohyphae and budding yeast at 20 degrees Celsius. We can see it in figure A right here. So, Candida forms pseudohyphae and budding yeasts at 20 degrees Celsius. So, pseudohyphae. What is pseudohyphae? So that is something that is just for Candida, pseudohyphae. This is pseudohyphae. These are the different types. Pseudohyphae, non-septate hyphae, and then septate hyphae. Okay, so hyphae are these like projections from this line, and pseudohyphae looks like this. So I guess it looks like hyphae, but it's not hyphae. I mean, it is hyphae, but it's not really the same structure as hyphae. Okay. Okay. So that's that. So see this pseudohyphae right here, and budding yeasts at 20 degrees Celsius, which is 68 degrees Fahrenheit. Okay. Candida forms germ tubes at 37 degrees Celsius, which means that Candida forms mold in 98.6 degrees Fahrenheit. Candida causes systemic or superficial fungal infections. Candida causes oral and esophageal thrush in immunocompromised patients. Okay, immunocompromised patients. Think of babies because they don't have a immune system when they're born. So neonates, right? When they're newborns, so they don't have their immune system is immature. So think of that. Think of people on steroids. Think of diabetics, and think of AIDS patients. They are all immunocompromised and they're prone to getting candida. So okay. Candida vulvovaginitis is common in diabetics and antibiotic users and women on birth control, but Candida does not change the pH of the vagina, okay? So, Candida vulvovaginitis is common in diabetics, and it's common people use antibiotics. Because the antibiotics will kill off the normal bacteria in the vagina, and then it allows the candida to grow. That's how you get vulvovaginitis in people who use antibiotics, and also in diabetics. Because I mean, well, the reason for diabetics is different. They just get vulvovaginitis. Okay. All right. Next. Now, people on steroids, remember we said that Candida causes oral and esophageal thrush. thrush in immunocompromised patients, people that are on steroids. The reason is because oral steroids have to be followed by oral rinsing to avoid development of oral candidiasis. So anything, um, anything like oral steroids, if you take it by mouth and you don't wash your mouth out, you can get um, oral candidiasis. Okay, so let's see. Okay, so oral steroids, you have to wash your mouth out, or you can get oral candidiasis. Okay, now um, candida also causes diaper rash. Okay, um, and candida causes endocarditis. IV drug users and okay, so candida causes endocarditis in IV drug users, and tricuspid valve is the most commonly affected valve. Remember that, they like to ask that. So remember, candida causes endocarditis in IV drug users, and a tricuspid valve is the most commonly affected. Okay, so candida also affect you can also get disseminated candidiasis, especially in neutropenic patients, so people who don't have enough neutrophils to fight. Yeah, the candida will take over because the fighters in your body, which are neutrophils, are very low and they can't fight off candida, so it will grow. Um, and chronic mucocutaneous candidiasis. Let's see. Okay, so this is candida. This is a genetic issue. It's a candida in it just causes candida to grow in your mouth, nails. This is a chronic problem. Okay. So this is candida growing on the scalp um, from chronic mucocutaneous candidiasis. Okay. All right, candida. Candida. This is candida. Um, you see this. You see the pseudohyphae right here. Right? Okay. So this right here is thrush, oral thrush, candida. The white stuff is candida. Okay, next. Um, so For treatment, you go with oral fluconazole or topical azoles for vaginal, oral fluconazole or topical azoles for vaginal, or nystatin or azoles, or rarely echinocandins for oral, fluconazole, echinocandins, or amphotericin B for esophageal or systemic disease. So for systemic infections, um, and if resistant to amphotericin B, give capsofungin. Okay, so what they for oral for like okay, for vaginal candida infections like vulvovaginitis, give oral fluconazole or topical azoles. And then nystatin azoles orally echinocandins for oral. Okay, so you don't give this for oral thrush. You don't. I mean, you can. It's just not recommended. You don't give nystatin azoles orally or echinocandins for oral. No, that's not. That's not what they said. For treatment, for the vagina, oral. Okay, for the vagina for candida growing there, you give fluconazole, which is orally, or you can put topical azoles, which is an ointment you can put on the vagina to get rid of the candida. And then for oral thrush, you can give nystatin azoles and sometimes echinocandins. So for oral thrush, think of azoles and think of nystatin. Okay, nystatin and azoles for oral thrush. Okay. All right. Next, you want to give fluconazole, echinocandins, or amphotericin B for esophageal or systemic disease. So for systemic infections, you want to give fluconazole, echinocandins, or amphotericin B, and if the person is resistant to amphotericin B, you want to give capsofungin. All right. So echinocandins, um, these are the type of fungins like capsofungin, micafungin, resofungin. So these are the I guess more potent ones, because if amphotericin is already potent, and if the patient is resistant to amphotericin B, and the candida keeps growing back, you want to give capsofungin, which is a type of echinocandins. Okay. Now, remember this, oral candida can progress to candidal esophagitis, and this is an AIDS-defining illness seen in CD count of 100 or less. Okay? Oral candidiasis can progress to candidal esophagitis, and this is an AIDS-defining illness seen in a CD4 count of 100 or less. For oral candidiasis, give nystatin. Okay, like we just said, candida is catalase positive, and candida is different from other dimorphic fungi in that it's a yeast in the cold and it's a mold in the heat. Remember we talked about this? Um, Budding yeast at 20 degrees Celsius, which is the cold. So it's a yeast in the cold and it's a mold in the heat. And germ tubes means it's a mold in the heat, 37 degrees Celsius is 98.6 Fahrenheit, which is your normal body temperature, or what it should be. and it will be a mold then. Okay. All right. Um, remember, candida can be scraped off, whereas leukoplakia can. Um, okay. Remember, candida can be scraped off, whereas leukoplakia cannot be scraped off. Potassium hydroxide used to prep for oral scrapings. Okay. Um, normal normal results indicate that there is no fungus. Okay. Positive potassium hydroxide test. There's no fungus present in your skin samples. It means your rash is caused by something else than a fungal infection. So if it's positive, fungal infection of skin. So if a positive. Okay, KOH test on a vaginal wet mount showing slings of pseudohyphae and candida surrounded by round vaginal epithelial cells, conferring diagnosis of candida vulgum. Okay, yeah, so positive potassium hydroxide test means that you have freaking candida. What did it say back? What does a positive KOH test indicate? Normal test results indicate that there is no fungus present in skin sample. This means that your rash is being caused by something else. Yeah, okay, so this is confusing in the way that they wrote it. Basically, with a positive potassium hydroxide test, that means you have candida. You're gonna see pseudohyphae right here. You're gonna see the pseudohyphae right here. That means you have candida, and that is a positive potassium hydroxide test. Okay, and that is how you test for candida. Now, if it doesn't show candida, your your infection is caused by some other type of thing. Okay, now let's see. Leukoplakia looks like candida. Oral leukoplakia. Oral leukoplakia. It looks like candida, but this cannot C-A-N-N-O-T cannot be scraped off. Okay, this white thing is leukoplakia. It's a precancerous condition. That's one of the ways that they differentiate on the exam um, between Candida and Leukoplegia. Okay, so this cannot be scraped off. I'm gonna make a note of that. Okay, so now we're done with Candida. The main thing to know about Candida is I'm gonna run through the main stuff that we gotta know. Candida is a white substance that can be scraped off your tongue. That can, C-A-N, can be scraped off your tongue, and it can cause um, skin infections as well as entire body infections known as systemic infection. You can get oral candida or esophageal candidiasis from the following: in immunocompromised patients, like in babies, people on steroids, and diabetics, and AIDS, and people who have AIDS. You can you can get the candida growing in your oral cavity or in the esophagitis, and if the oral candidiasis progresses to candidoesophagitis, this is an AIDS-defining illness. It means you have AIDS. It means your CD4 count dropped to 100 or below that. Okay, so that means you have AIDS. Okay, and next, vulvovaginitis. It's Candida causes vulvovaginitis in diabetics and people on antibiotics. Candida can also cause diaper rash and endocarditis in IV drug users, and the tricuspid valve is most commonly affected. And disseminated candidiasis, especially in people with low neutrophil count, and you also see candida in chronic mucocutaneous candidiasis, which is a genetic condition. And the treatment for vaginal candidiasis the treatment for vaginal candidiasis is oral fluconazole and topical azoles. And for oral candida, you give nystatin, azoles, or sometimes echinocandins, which are the fungins, like the drugs that end in FUNGIN. And then, if the patient is, you can also, for systemic disease in Candida spreads all over the entire body, you can give fluconazole, echinocandins, or amphotericin B. And the patient is resistant to amphotericin B, you give the capsofungin. Remember, Candida does not change the pH of the vagina, okay? Even though it causes the vulvovaginitis, it does not change the pH of the vagina. Candida vulvovaginitis is common in diabetics and antibiotic users and women on birth control, but Candida does not change the pH of the vagina. And Candida is a yeast in cold temperature, and it is a mold in hot temperature. Okay. Next, I'm going to go into Candida. Is the reason we spend so much time on Candida, it's extremely heavily tested. It's always tested. You have to know Candida inside out. Alright? Okay. Aspergillus fumigatus. It's a septate hyphae that branches at 45 degrees acute angle. As you can see in D, figure D, right here. So this right here okay, so this right here is Aspergillus fumigatus. It septate hyphae that branch at 45 degrees acute angle. You can see that right here. See this? Small angles. Aspergillus, okay? Alright. Now, next. Aspergillus causes invasive aspergillosis in immunocompromised patients. Neutrophil dysfunction, like in chronic granulomatous disease. Aspergillus fumigatus can cause aspergillomas in pre-existing lung cavities, especially after a TB infection. That is seen in figure F. Let me show you. Figure F is down here. See this? This is the aspergilloma. Aspergilloma can affect you after infection with a TB patient, because your lungs are already damaged, so it makes it easy for Aspergillus to come and create chaos. So that's there. Some species of Aspergillus produce alpha toxins. Some species of Aspergillus produce alpha toxins. The alpha toxins are associated with hepatocellular carcinoma. The treatment is voriconazole or echinocandins. Echinocandins, which are the fungins, the ones that end in fungin. They're second line though. The treatment for Aspergillus is voriconazole. Now, there are 3 types of aspergillosis that you need to know. Which is the first one is ABPA, which is allergic bronchopulmonary aspergillosis. Okay, so we're gonna take like a 10-minute break, and we'll be back. Okay. Sorry guys, had to help my parents with groceries. Okay, let's see. Um, where were we? Oh yes. Mm, some species of Aspergillus. No, we did this. It produces aflatoxins, which is associated with liver cancer. Allergic bronchopulmonary aspergillosis, ABPA, is a hypersensitive response to aspergillus uh, growing in the lung mucus. A hypersensitive response to aspergillus growing in the lung mucus. This is associated with asthma and cystic fibrosis, may cause bronchiectasis and eosinophilia. Okay. Um, let's see. Uh, three types of aspergillosis: ABPA, which we just talked about. Mainly, this causes fever and migraine. Um, it is a hypersensitive response. It is a type 1 hypersensitivity response. So there'll be increased IgE in the um, in ABPA. It's a reaction to the lung um, to that to the aspergillus growing in the lung. It's also associated with asthma, cystic fibrosis, may cause bronchoectasis, and eosinophilia. Now, the second type you gotta know is aspergillus, which is a solid ball of fungus in your lungs. Number three is angioinvasive aspergillosis, which is the worst one, and it affects immunocompromised patients. And fungus invades the blood vessels and spreads to the rest of the body. Um, you get endocarditis and ring-enhancing lesions, and kidney failure and necrosis around the nose in the angioinvasive aspergillosis. Okay, now, yeah. Okay, so the main things you have to know about aspergillosis: it is catalase positive, just like candida is catalase positive. So it's not just bacteria; fungus can also be catalase positive. Okay, all right. Mm-hmm. So aspergillus likes to affect TB patients because your lungs are already damaged. Now, Aspergillus flavus produces alpha toxin that causes hepatocellular carcinoma. Peanuts is associated with alpha toxin. Okay. So Aspergillus flavus produces alpha toxin that causes hepatocellular carcinoma. Peanuts is associated with alpha toxin. So think of peanuts and liver cancer. Okay. All right. Now, the other thing you have to know: there's three types of aspergillosis. The first one is ABPA. Maybe I can look it up. Aspergillosis. Aspergillosis bronchopulmonary. Okay, so this is what this is. See this? These balls over here. The, this is what that is. Okay, allergic bronchopulmonary aspergillosis. It's type 1 hypersensitivity reaction, so IgE will be up. Now, if you just have aspergillosis, it is like a lone lesion, like not a lesion. It's like a ball in your lungs. Let me show you. Looking for a good picture. Right here. So this is aspergillosis right here. Okay. All right. Next. Angioinvasive aspergillosis, it's the worst one. It causes endocarditis, ring enhancing lesion of the brain. Okay. Ring enhancing lesion. Ring enhancing lesion. See this. This is remember we talked about disseminated aspergillosis that we just talked about as the worst one, angioinvasive aspergillosis. That's disseminated aspergillosis, and you see this ring enhancing lesion. So ring enhancing lesions you see in one other condition. It is the it's toxoplasmosis. Let's just look it up. Gandhi. Yeah. So in Toxoplasma gondii, you also see multiple ring enhancing lesions on MRI, which is right here. So you see ring enhancing lesions in T. gondii, Toxoplasma gondii, and then also in Aspergillus fumigatus, but the disseminated type. Okay. All right. So remember that, but don't jump to Toxoplasma gondii when you see ring enhancing lesions in the brain. Okay. And you also see kidney failure and necrosis around the nose in angioinvasive aspergillosis. Yeah, that's it. And the treatment is voriconazole. Or echinocandins, which is second line. The third one is Cryptococcus neoformans. It is 5 to 10 UN with narrow budding. It is heavily encapsulated. It's a heavily encapsulated yeast. It's not dimorphic. What does it mean to be dimorphic? Let's see. Okay, dimorphic fungus. Is a dimorphic fungus are fungi that have a yeast phase and a mold phase. So it just means that it can convert into either mold or yeast. You can convert into, I'm not going to comment in most areas, but to convert mold form or yeast. Let's see. Just making a note of this. Can convert to can convert to fungus. Sorry, can convert to yeast or mold. Okay, so that's what dimorphic means. It can convert to yeast or mold. Um, so Candida albicans is a dimorphic fungus, and Cryptococcus neoformans is not dimorphic. Not dimorphic. So it cannot convert to yeast or mold. Okay. Cryptococcus neoformans is found in soil and pigeon droppings. Cryptococcus neoformans is acquired through inhalation with hematogenous dissemination, which means that you inhale the Cryptococcus neoformans, um, and then it spreads in your body through blood. So acquired through inhalation with hematogenous dissemination to the meninges. Cryptococcus neoformans is highlighted with India ink. Yeah, Cryptococcus neoformans is highlighted with India ink, and you see a clear halo, which is figure G right here. Figure G. Figure G. Figure G. And muci carmine red inner capsule, which is H. So right here we'll get into that. See this red? That means that it is Cryptococcus neoformans. Okay, so latex agglutination test detects polysaccharide capsular antigen and is more sensitive and specific. The Cryptococcus neoformans causes cryptococcus, cryptococcal meningitis, cryptococcal encephalitis, and is primarily in the immunocompromised. The treatment is with amphotericin B and flucloxacin, followed by fluconazole for cryptococcal meningitis. Alright, so what we have to know about Cryptococcus neoformans is that it is urease positive. It is not a dimorphic fungi. Cryptococcus enters the body through inhalation and goes to the lungs by blood. Travels by blood. Cryptococcus neoformans symptoms is fever, pneumonia, meningitis. It's heavily encapsulated. The capsule is made up of repeating polysaccharide capsular antigens. So the capsule is made up of repeating polysaccharide capsules. No, sorry. The capsule is made up of repeating polysaccharide. The capsule of Cryptococcus neoformans is made up of repeating polysaccharide capsular antigens. Yeah. Okay. And you see India ink, clear halo. You can identify Cryptococcus with India ink, and you see a clear halo in the center, which is what we just saw in Figure G. And you can also identify Cryptococcus with the muci carmine, the stain, I guess. Yeah, something like. Let's look it up. Muci carmine. Yeah, it's okay. Muci carmine stain is something that strains the Cryptococcus, and it stains red. So it will look red. The capsule will look red. The inside of the capsule will look red. And then latex agglutination test detects polysaccharide capsular antigen and is more sensitive and specific. So because latex agglutination test detects capsular antigen and causes agglutination. Yeah. So the reason that the latex agglutination test is more sensitive and specific is because latex agglutination test detects capsular antigen and causes agglutination. Okay, so you know when the antigens, because latex agglutination test detects the capsular antigen and causes agglutination. Yeah, and the antigens will agglutinate. Okay, because latex agglutination test detects because latex agglutination test detects capsular antigen and causes agglutination. So I guess the antigens in the capsule will agglutinate, and that tells you that it is Cryptococcus. And this is done through latex test, which is the most sensitive. Okay, now you have to know that Cryptococcus causes Cryptococcus, and then cryptococcal meningitis and cryptococcal encephalitis, and in cryptococcal encephalitis, you see soap bubble lesions. Um, in cryptococcal encephalitis, you see soap bubble lesions. Let's see, in cryptococcal encephalitis, you see soap bubble lesions. You see soap bubble lesions in the gray matter of the brain, and this is in the HIV patients. If you see soap bubble lesions in the brain, it's here. It's most likely to be in a HIV patient because this happens um, in immunocompromised patient. Soap bubble lesions. Oh, it doesn't look like soap bubbles to me. I imagine soap bubbles to be just bubbles. I mean, that way, let's see. Soap bubble lesions. This is India ink stain right here. You see the clear halo. Okay. Now, polysaccharide capsule antigen can be detected using in the lab using latex agglutination test. Urea is positive. This means that it produces ammonia. It's transmitted from spores of pigeon droppings and pigeon droppings, and is also found in the soil. So if you inhale that, it can go to your lungs through blood. You see this hematogenous spread too. Acquired through inhalation with hematogenous dissemination to the meninges. Okay, so you inhale it, you inhale the spores, it goes to your lungs, and then from the lungs it will go to your brain by blood. So hematogenous spread to the meninges, inhalation to the lungs because of spores, and then from the lungs it will go to the brain by blood. Inhalation of spores. Through inhalation of spores goes to lungs and then goes to meninges by blood. Okay, so Cryptococcus enters the body through inhalation of spores and goes to the lungs and then goes to the meninges by blood. You see soap bubble lesions in the brain, in the gray matter of the brain, and this will be in, see the soap bubble lesions in the brain are associated with Cryptococcus neoformans. Soap bubble lesions in the brain consistent. So, I mean, yeah, that looks, let's see, what is neurosis? Because to me, if you just show me that picture, I guess you had to identify with the other symptoms they give, neurocysticosis, MRI. It looks, I don't even think you can differentiate by, oh, if you can, oh gosh, this is, I can't look at this picture, it's so disgusting to me, I can't look at this picture, oh my gosh, it gives me the heebie-jeebies, bro, I can't. Okay, so they both are nasty, but the other thing, I know it's because the other one is worms, it's as a parasite, and that to me, I've always had this intense fear as a kid of holes and of parasites, bugs in general. Okay, so 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 in neurocysticosis, which is caused by Taenia solium, which is a parasite, you see black eggs, and this is white, like it's white. So these are soap bubble lesions. Soap bubble lesions. It's soap bubble lesions in Cryptococcus in the gray matter of the brain. It's seen in HIV patients. And the treatment is with amphotericin B and fluclocytosine, followed by fluconazole for cryptococcal meningitis. Amphotericin B and fluclocytosine. Remember that. Remember the treatment. Amphotericin B and fluclocytosine, followed by fluconazole for cryptococcal meningitis. Amphotericin B and fluclocytosine, and followed by fluconazole for cryptococcal meningitis. Now, yep. All right. So that's that. Let's see. So this purple thing on the side, this is aspergillus, okay? This is what aspergillus looks like. And this is the acute angle of aspergillus. Close up. Okay, so next is Mucor and Rhizopus species. This is a irregular, broad, non-septate hyphae branching at wide angles. You see this right here? So this figure I, this is mucormycosis. It's often fatal. Okay, irregular, broad, non-septate. You don't see the little septate, right? You just see an angle. You just see a wide angle. Non-septate hyphae branching at wide angles causes this mucor and rhizopus. It causes mucormycosis, mostly in ketoacidic diabetic patients and or neutropenic patients, especially in ones that have leukemia. Mucor and rhizopus, it's inhalation of spores. Yeah, you get it by inhalation of spores, and then the fungi proliferate in the blood vessel walls, and then it penetrates the cribriform plate and enters the brain. Rhinocerebral front lobe abscess, cavernous sinus thrombosis, headache, facial pain, black necrotic eschar on the face, like seen in figure J right here. See this? This is mucormycosis. Okay. Headache, facial pain, black necrotic eschar on the face. I may have cranial nerve involvement. Treatment is with surgical debridement. You give amphotericin B because this is a severe disease. Okay, and or isavuconazole. All right. All right. So we had to know a mucor species. You had to know this. You had to know after invading the blood vessels, the fungi penetrate the cribriform plate and cause necrosis and frontal lobe abscesses. Okay. All right. And mucormycosis, they like to infect um, um, wherever there is high sugar. And where is which type of disease is going to be the highest sugar? It's going to be ketoacidosis, where your sugar is literally uncontrolled. Um, yeah, ketoacidosis patients. Okay, so it's an opportunistic piece of crap. Mucormycosis. I don't know how else to describe it. All right. So in ketoacidosis, there's high sugar, high ketones. Um, it's gonna come and take advantage. Okay. All right. So and then neutropenic patients like leukemia because there's no neutrophils. Where's cribriform plate? Let me show you cribriform plate. Okay, so this right here is the cribriform plate. This green thing. So it's right here, cribriform plate. So Micor and Rhizopus species likes to go into your nose um, and then infect the blood vessel walls, penetrate the cribriform plate right here, cribriform plate, um, and enter the brain, rhinocerebral front lobe abscess. So you can get a frontal lobe abscess. Frontal lobe is right here. The frontal lobe. Okay, you can get frontal lobe abscess, and cavernous sinus thrombosis. What is cavernous? Cavernous sinus thrombosis. Okay, so cavernous sinus thrombosis is a blood clot in the cavernous sinus. It can be life-threatening. Cavernous sinuses are hollow spaces located under the brain behind each eye socket. Major blood vessel called jugular vein carries blood through the cavernous sinus away from brain. Okay, so this is the cavernous sinus thrombosis, the clot, blood clot right there behind your eyes. Okay. So mucormycosis, mucor species can cause that. It's often bilateral, ipsilateral orbital inflammation and proptosis. Okay, so that's what that is. Next. Okay, so mucormycosis can cause cavernous sinus thrombosis and frontal lobe abscess. You treat with amphotericin B or isavuconazole. Okay, but the thing is that's often fatal because the patient is already immunocompromised and then you have this evil fungus that grows. So, yeah. Alright, next. Okay, so we're going to finish off these two, and then we're going to start the next video with parasitology, my favorite. Alright, so PCP. So pneumocystitis jirovecii, it causes pneumocystitis pneumonia, which is PCP pneumonia. It is a diffuse interstitial pneumonia, like in this figure right here, A. Okay. diffuse interstitial pneumonia, A. And is the yeast-like fungus originally classified as a protozoan? So this is a fungus, okay? Most infections are asymptomatic. Immunosuppression. It affects, yeah, this is almost always only seen in AIDS patients, okay? So pneumocystis cerevisiae is seen in AIDS patients. Okay, if somebody has BCP pneumonia, assume that patient has AIDS. Okay, so diffuse bilateral ground glass opacities on chest imaging with pneumococcyles. So right here, this is a picture of BCP pneumonia. You see diffuse interstitial pneumonia that looks like ground glass, that looks like broken glass. Okay, all right. Diagnosed by bronchial alveolar rupture or lung biopsy. This is a disc-shaped yeast seen on methenamine silver stain of lung tissue. So right here, this is a stain, silver stain. It's a silver stain, and you see this pneumocystis cerevisiae looks like discs. So remember that that's how you identify on silver stain, okay? Methenamine silver stain, or with a fluorescent antibody. But this is more important. Figure C is extremely important. Remember that. Treatment and prophylaxis. TMP-SMX, pentamidine, dapsone. Prophylaxis as single agent or treatment in combination with TMP, atovaquone. Start the prophylaxis when CD4 count drops to below 200 cells in HIV patients. Okay. So what you have to know is pneumocystis cerevisiae is an AIDS-defining illness and is transmitted by respiratory droplets. And it is seen on silver stain of the lungs. And now treatment. TMP, SMX, pentamidine, and dapsone. Dapsone is prophylaxis when you give it by itself, but in treatment, if the patient actually has if CD4 count has already dropped to like less than 200. Yeah, like the patient already has the pneumocystis cerevisiae. If you take an X-ray and you see broken glass, like if you see this figure of broken glass, then you know the patient has pneumocystis cerevisiae. So you give dapsone along with TMP SMX. Okay, the patient actually has it. You give dapsone along with TMP SMX with the patient. If it's just a prophylaxis, give dapsone only. And yeah, so treatment, TMP SMX, pentamidine, dapsone, and TMP SMX, and atovaquone. All of these can be used for treatment. Prophylaxis is dapsone, okay? So you start the prophylaxis when CD4 count drops to below 200 cells in HIV patients. Susceptibility to PCP becomes an issue when CD4 count drops below 200. Pentamidine you give if the patient is allergic to sulfa drugs. What are sulfa drugs? Okay. Sulfa drugs are sulfadiazine, sulfamethoxyl. Okay. So TMPSMX is a sulfa drug. Yeah, it's classified under sulfa drug. So basically, the patient is allergic to TMPSMX, you give pentamidine. Okay, patient is allergic to TMPSMX. If patient is allergic to TMP SMX, give pentamidine. Okay, alright. So we need to know that infection in PCP pneumonia, infection spreads in ascending pattern along the path of draining lymphatics. So it spreads in ascending pattern. So it starts from the bottom and goes up. Ascending pattern along the path of draining lymphatics. Remember that? Okay. Alright, next. Remember, the PCP pneumonia is transmitted by sneezing, like droplets. Okay. Alright. Now this Sporothrix shanky. Okay. So this, I know this very well because we'll get into that. Okay. Causes sporotrichosis. It is a dimorphic fungus, which means it can convert to a yeast or a mold. This exists as a cigar-shaped yeast at 37 degrees Celsius in the human body and has hyphae with spores in the soil. Okay, candida. Alright, candida is this. Okay, candida is candida. Like, remember that figure bacteria? It looks like a rose. I mean, like a flower. Candida. So right here, this is what this is. This is Sporothrix, and Sporothrix looks like this is candida. Okay. Now, causes sporotrichosis, dimorphic fungus, exists as a cigar-shaped yeast in 37 degrees Celsius in the human body and is a hyphae with spores in the soil. It lives on vegetation, means it lives on greens, like greenery. When spores are dramatically introduced into the skin, typically a thorn, causes a local pustule or ulcer with nodules along draining lymphatics. And it is ascending lymphangitis. It is a disseminated disease possible in immunocompromised host. Treatment is itraconazole or potassium iodide only for cutaneous and lymphocutaneous. Okay. So think of rose gardener who smokes a cigar on a pot. So what you guys know about this is that it looks like a cigar-shaped yeast under the microscope. Okay, and then Sporothrix is found in the nose, thorns, tree bark, and other parts, especially in rose bushes. Okay, and it is a dimorphic fungus, which is not a dimorphic fungus. One that is not a dimorphic fungus is an Cryptococcus neoformata. Okay, and Sporothrix is a dimorphic fungus, and it lives on rose bushes, early type of plants. But it looks like a cigar-shaped yeast under the microscope and in the human body. But in the soil, it looks like hyphae. Okay, when spores are traumatically introduced, so basically when you accidentally jump on a thorn, on thorns or a rose bush, that's traumatic. So what happened was me, my brother, my sister, we were kids, we were sneaking out of the house to get McDonald's at 1 a.m. and outside our house, My parents love rose bushes, so they planted a bunch of rose bushes up so high, like literally they were kids from like probably like 5 feet tall. And then I don't think my brother made it 5 feet. Yeah. So basically, we had to jump out the window, and my brother and my sister they jumped out the window just fine. They were pretty athletic. I was not. Um, they jumped over the rose bush. I jumped directly into the rose bush, and then I had all of these like um, ulcers, I guess. Like it would be one or two random ulcers, and it would be draining that would hurt, and I would not know what this was because I was freaking out. Like, what is this? My parents were just like, what happened? I'm like, I don't know. And of course, we did not make the connection that we got it from a rose bush, but most likely that's what happened because I can't think of anything else. And I was the only one who got it. They were fine, and it just what happened. This happened like a week or 10 days after I fell right into the rose bush, scratched my entire body, was screaming in pain until my brother and sister got me out. So yeah, I'm not gonna forget this. Okay. So at that point, there were cigarette-shaped yeasts in my body. Yes. So local posture or ulcer with nodules along draining lymphatics. So this is ascending lymphangitis. And treatment is with itraconazole or potassium iodide. But that's only for skin infections. Itraconazole or potassium iodide. And road runners like get this disease because they're always pricking their fingers. All right, that's it for microbiology. So I'm gonna share with you already.